so anyone can see this after we finish. What else? Our audience, please, you can make any questions, any comments on the comment sections on Facebook and LinkedIn. Okay, so feel free to make all the questions in the end of this event, of our conversation, our chat. We're going to select a few questions. And also, if you have any questions, if you want to know a bit more about EIT Health, you can go to eithealth.eu or innostarter.eithealth.eu, and also to the Investor Network page. All these links will be pasted on the comment section, so don't worry, you'll not miss a thing. So let's start. Welcome again, Caroline. Thank you so much for being here. It's a pleasure to have you. As the European head of operation, both for Investor Network and also Angel Santé, I imagine you come across thousands of healthcare startups per year. And also you follow up several funding rounds, right? So can you tell us a bit about how your work looks like your daily, weekly, yearly work?
Yeah, well, I'm very fortunate. I have a very exciting job, very challenging. In essence, it's twofold. I do a lot of networking and a lot of selling. Networking because, of course, I'm the link between healthcare startups and healthcare investors. So that means I need to be aware of what's happening and who is who in the European ecosystem in healthcare. And I do a lot of selling because, of course, I have two internal customers, the startups that come to us and that need help and a lot of boosting for their fundraising, and the investors that are members of our network that are also looking for great qualified deal flow. So I have to keep both of my customers happy. And once I convince companies to come and to us so that we can help them out, then I need to make sure that my investors take a look at them and that we bring them the deals that they're looking for. So it's a lot of push and pull on both sides.
Yeah, I imagine. But so the Investor Network started its operations officially in 2019, right? So since then you supported many companies. You help them to get investment, not only through the investors in the Investor Network. And here we are seeing a slide with the representation of the investors in the Investor Network. So we have over 80 healthcare investors from 18 different countries and not only European countries. So for the last 2 years and even more with your experience in Angel Santé, what has been the trend so far? What is trendy this year, and what's going to be trendy for the next years? Where are investors putting their money?
Well, things are a little bit changing. Obviously, digital health is an up and coming sector. It is. Today, I think when it comes to digital health companies, of course, there's a lot of remote monitoring, home care solutions, following the patients, predictive diagnostics, things like that. The investors will put their money in digital health companies if there is already traction and revenue for digital health companies. That's for sure. In the medtech sector, a lot of therapeutics with a lot of data, definitely. Investors today are looking, of course, for deep tech companies. That's the big thing, deep tech, AI. And they also want something that is really disruptive. So it's great for the disruptive companies, a little bit more difficult for the companies that are a bit more traditional in the way they function. And in biotech.
When you say traditional, you mean like in the way in their business model or in the technology?
More in the technology. Let's say if you are a medical device that has taken an older technology and you're making it a little bit more modern, that might not be sufficient to convince investors that you're a great moneymaker.
Okay.
They really want to see not only that you are filling an unmet medical need and that you're bringing value both to the patient and to the healthcare system. So whether it be the insurers, the hospitals, you need to be able to save money and to save lives in essence. So that makes it challenging, especially since you need to convince them that you're filling all those boxes, that you are disruptive, that you're doing something that no one else is doing. And by doing so, they should invest in you because you will be making a lot of savings for the hospitals and the whole healthcare system wherever you are in the world.
Yeah. Okay.
So and in biotech, look, in biotech, the big thing right now is gene and cell therapy, a lot of advanced therapy, especially in the realm of oncology, aging, mental health, anything linked with Parkinson and anything linked to mental diseases, obviously, is a big thing. So
the chronic diseases of our times, right? That we have been trying to solve for years,
and for which there are no solutions. And anything that is linked to the mental health is also very complicated because there are no good therapeutic solutions today. So they'll be ready to take their bet on risky solutions that need a lot of investment over a long period of time, like in biopharma. But you need to have a lot of preliminary data that shows that it's promising
and impactful. That has a big cap. So high risk, if big impact in the end, right? And solid evidence.
Absolutely. And the lower the length or the less money you need, the more you will necessarily have to show that you have traction. So digital health companies, you need to have some traction, some sort of revenue in your own country and possibly elsewhere. MedTech solutions, you need to be very close to the regulatory pathway. Usually serious investors will not come in if you're like more than a year to 6 months from your regulatory pathway, whether it's in Europe or in the US. And for biotech companies, you definitely need preclinical data to show. Even better if you have for Series A, even better if you have phase 1 data to show.
Yeah, definitely. Did you see COVID changing this a bit? So not only
Well, not really. I think investors at the beginning, I saw more changes in terms of numbers of startups fundraising. At the beginning of the COVID, a lot of startups put on hold their fundraising for 2 reasons. One is a lot of them were supposed to do clinical trials and they couldn't have access to the hospitals or the patients. So obviously they had to put that on hold. Or they were afraid that because they couldn't reach the milestones they were supposed to reach, that their valuation would plunge. And they didn't want to risk having to do a fundraising round with a lower valuations. So they would put that on hold. Investors, sure, we've had investors who told us, oh, no, at the beginning, because nobody knew where this was going. They said, we're putting our money into our portfolio companies. We want to be able to support them. And because we don't know how long it's going to last, we need to make sure that our money goes to helping our companies survive. Towards June, July, we saw that things were changing and they realized that COVID wasn't going anywhere and that they had to get back to normal business. And so strangely enough, you even saw VCs who previously would have never done a deal without meeting the teams.
Online, everything online.
they did
deals.
online,
Yeah.
yeah, which is super difficult because, as you know, doing a deal, especially in early stage startups, it's a lot about trust and a lot about being convinced by the team. The team is a
Dating
big thing.
is a dating process, right? Where you need to build that trust
Yeah,
and yeah,
so
exactly.
building the trust can be by going to also to the restaurant and having a drink and see how you perform under a lot of alcohol. I don't know, but so they learn how to function in a different way. So I think companies were quite innovative that they were able to convince and send out messages of trust to investors through Zoom or whichever tool they
it
used.
might it might have worked as an additional filter, right? Because only like the real good ones and committed were also forced to get out of their comfort zone and okay, we really want this, we are really ready. So how can we convince them and in this new normal that we're facing? So
Yeah, I'm sure that, no, you're right. You're right. I'm sure that you have to be a little bit charismatic when you're talking through Zoom and you want to convince. So either you're super charismatic or you've got super data to back you up. If you have both, that's even better.
yeah.
So
But
in
that's
the
definitely
end,
something they should work, right? If if a startup company CEO realize that okay, I have some communication gaps here, it's not working. So this is something that they can upskill before entering their fundraising process like full speed, right?
absolutely. And I would say you shouldn't be ashamed of not being completely at ease with these kind of tools. And you should be very comfortable in getting someone else from your team who is to sell your
Exactly.
company. You have to remember that a pitch to an investor, it doesn't mean a check at the end of the pitch. It means getting a deep dive interview with them. So
Exactly.
you're actually selling your company in 10 minutes, which is very difficult. So you need to be as impactful as possible. And if you don't feel comfortable doing that job, then get somebody else, even if it's your CTO or your CFO, whoever, get somebody else to do the pitch, be convincing. I've seen companies that hire people just to do their pitch during their fundraising sessions.
Yeah.
Of course, the
Yeah.
CEO is there to answer the questions,
Exactly. And also
but
shows the
they
team commitment, right? In that they are they are a team and not a one man show or one woman show, right?
that's very true. And also, it shows that the CEO is humble enough to know that he's not perfect everywhere, that his strength lies elsewhere, and that he's intelligent enough to go and get the help he needs. And this is what we always say to startups, that when you're building a team, even if you haven't finished building it, at least you know exactly what kind of person you want to go and get, whether it be a CEO to replace you because you are a researcher and you can't take your company to the next level,
Yeah.
or that you don't have the skills to bring your company to market and you need a business developer. So it's also a good proof of being very humble and knowing your strengths and weaknesses very
Yeah.
well.
Yeah,
So,
exactly. Yeah,
yeah.
that's a very good tip. Let me just remind our audience that we are live on EIT Health InnoStar's Facebook and LinkedIn. You can make all the questions and comments you want in the comment sections of the lives. If you also want to get a very quick idea of what Investor Network is, we will be pasting a 1.5 minute video Investor Network has. It's also available in their YouTube channel, but it's their 1.5 minute pitch. Very good for you to get perspective, some data. And yes, please just make the questions you want in the comment sections. So among the supported companies since 2019, we have two InnoStars success cases. And for those of you who don't know what InnoStars is one of the EIT Health regions that covers Southern and Central Eastern Europe, okay? So among the many companies supported or that got invested with the support of EIT Health Investor Network, we have two Italian startups. The first one, and it was actually the very first company
to apply.
Exactly, Teia Care. They raised 1.1 million in 2019, right?
Yeah.
And the second one was Patch AI, who was also one of our second or third invited startups in the first episodes of the Rise to the Challenge series. And Patch AI just closed their bridge round early this year, 1.7 million euros. And they are now coming back to get further support for their next round. So how do you see these companies? Of course, we have to make it a bit general, like Innostar's companies, Southern and Central Eastern Europe, there's cultural differences, of course. But how do you see these companies coming from, well, less innovative countries when compared with Central Europe? What's their secret sauce? What's their competitive advantage? How do you see them?
Well, in the case of Teia Care and Patch AI, both CEOs are extraordinarily vibrant and energetic people. So
charismatic.
Charismatic. There you go. Listen, I think for the Southern Europe, you have to be realistic. These companies, I mean, you have very innovative areas through the universities across Italy, Spain, Portugal. But there is a lack, especially for Italy or Portugal, there's a lack of VCs and family offices that go into the early stage realm. So I would say those companies that are emerging from those countries are probably even better than the others because they've had to go through all these hurdles of finding investment to move forward. And yesterday I was speaking to an investor from Ireland who was saying, you know, I really appreciate hardship in a startup. So without talking really about hardship, I still think those companies that do make it to above seed stage, that make it to bridge and Series A stage, it means they had very convincing arguments for investors. And I think they've had a vision of going beyond their borders. And that's what makes a difference. Patch AI and Teia Care, those were cross-border deals. So, and they have a vision of developing in Europe. And that's important. I think for those countries, you have to really think European very quickly because you will find yourself against the wall when it comes to public funding. Exactly. Undoubtedly, there's less public funding than in some countries like Germany or France that are full of public money. And unlike the UK, that has a lot of private investors, you know, Italy and Portugal are they have a less generous system when it comes to private equity. So
yeah. I think, and also in Central Eastern, like Europe, like Poland and Hungary, so it's the ecosystem, let's say the startup, the investor ecosystem, now it's getting there, but it took some time. And for healthcare, it's even worse when most of the things come from research, right? So yes, you have a lot of grants you can apply from Europe, European Commission, but also nationally. But then there's a wall, exactly, just like you said, there's a wall. And you need to start thinking ahead. What's my plan after? So in 2 years, in 3 years, so where do we want to go? Yeah.
And I would say one of the things that can also help you is to make sure that right from the beginning, you build a group of key opinion leaders that are outside of your country. Go get international key opinion leaders that can validate your value proposition. And that will, right from the start, without costing too much, will already give you some sort of international scope to your project, and will probably be a great argument for investors to say, okay, well, so-and-so in the US or so-and-so in the UK said that your product is great. So
It works kind of a validation or pre-validation before going
and that's what I was talking about, me doing a lot of networking at the beginning, but I think even startups have to do a lot of networking on an international level very quickly. And try to publish as much as possible as well. Don't forget your IP portfolio as well when you can. That's super important. Go to events, even if you're just an attendee and you're listening in, network.
Something will sink in, and also contacts. And you never know when that contact will actually be, let's say, used, right? And
Absolutely.
when that person will remember you.
Yeah, and 81%, studies have shown that 81% of deals are done through referral. And that's why the investor network is so important, is because we highlight the companies to people that we know, that we've interviewed. And so we keep track of all our investors, where they invest, in what kind of stage development and geography, etc. So we do the qualification for startups and we do the push for startups, but referral is all, and you never know exactly. It can be maybe not necessarily money that people will give you. They will open a door. They will give you a contact for a KOL, or they can also help you with partnerships with industrial partners. So networking. I know it takes a long time. I mean, I spent a lot of hours networking, but it's super useful.
Yeah, definitely. Let's dig a bit into the investor network process. But before that, let me just remind our audience, make questions. We're here to answer your questions. You can write your questions in the comment sections on Facebook and LinkedIn of this live. Okay, we are live in EIT Health InnoStars. Also, this will be posted in our 2 pages, so you can watch it later. Don't worry about it. All the links you need are there: EIT Health website, Investor Network website, InnoStarter website. There's even a YouTube video of 1.5 minutes. You can watch it later. But now let's get to what really matters today, which is how does Investor Network works. There's a ranking there, so you can explain this a little bit. So just tell us.
Okay, so in essence, the investor network is the link between, on one side, the startups that are raising seed and Series A rounds in healthcare, and they have to be European registered. And on the other side, early stage investors specialized in healthcare, whether they be, as you saw, VCs, family offices, CVCs, angel groups, or super angels. That are looking for a qualified deal flow. So the startups come to us because they know that we have this whole database. We have these members that we have qualified. We know who invests in what, and we can bring them to those investors, and that will have a lot more weight than if they go by themselves. They knock at the door and they wait for the door to be open. We have the key to the door. So we go in and we say, hey, take a look at this great project. Might not be a good fit, but at least they will look at it.
Okay. So this is something, let me just interrupt you for a second. This is something often startups ask me, can we get in contact directly with investors? No, right? You are the key to that door.
Yeah.
You do this
Absolutely. There's one thing you have to understand about investors is a big fund, a fund that will have, let's say, above 100 million euros in management, will get something like 1,000 companies a year that sends them their deck. Okay. And they usually spend less than 4 minutes looking at your deck.
Yeah.
So your chances of being looked at well and of coming out of the pile is minimum. And from what I've seen with the startups that we work with, many of them contact the wrong people at the wrong time. They'll be like a diagnostic company and they'll waste their time contacting a therapeutic investor who will never invest at seed stage and never in that country. So it's a waste of time, and it's a waste of your image as well, and of your reputation. So that's where we come in. We do the qualification for startups, and we do the highlighting, and we do the push. And one of the ways we do the highlighting is that we indeed have a 3-tier system: gold, silver, and bronze. Why? Because they're companies that are above average, they're good, but they still have a few things that we feel they need to make absolutely right before going to see an investor. Why? Because an investor, if he takes a look at 1,000 companies a year, and I push your project under his nose once, and he says, oh, they're not ready. Look, their pre-money valuation is way too high. They don't have a good IP portfolio, or they have no clue as to their business model. Don't bother me again with that company.
Yeah.
And that will be true for a whole year. And one of the things that is very negative is when a company sends out his deck to everybody, the environment, the ecosystem is very small. And they say, oh, that company, yeah, I heard, no, they're not ready. So that's why we only highlight in a very, very active fashion only our gold company, the ones that reach the highest grading of above 80. The silver companies, they're really good, but we still ask them to sort of, clean a little bit their deck and just have some coaching or whatever, and then they can be reassessed to get extra points to be a gold. And the bronze, we're saying those are the bronze companies do not get into the network, so they're not visible on the platform like our silver companies or gold companies. But we're telling them you're not really far, but you still have maybe 6 months to work on a few things, and then you can come back and be reevaluated for free.
Okay.
And then the ones who are below 60 points, those are very companies that should have come to an event like this one and realized that they weren't ready at all. So
I hope we have many companies here today listen to this. I hope they are already somehow above 60. And here we are talking about points from 0 to 100. This evaluation is made by investors, so evaluators who are also investors, right? And this application, so you submit your application, and in order to be evaluated, and by the way, it's a long application form, but has all the information an investor needs to assess it, right?
Absolutely.
So it's something people should not rush.
They shouldn't rush it, but they should finish it.
Yes, and click the submit button.
Yeah, and click the submit button. Yeah, the reason we ask all these questions is because indeed, when you take a look at a company, especially if it's a pre-evaluation, not a due diligence, you need to have a good idea of various points. We grade the companies over 18 items. So to grade them, not only is there the written application, but there's a 1-hour call with these 2 healthcare investors that are specialists in that vertical. So obviously for a biotech company, we'll give them biotech investors, right? And that element of the application will go directly also to our platform once the company is accepted, and that will be viewed by our investors. And so that's why you do the work once. You do the application, and then we do the uploading on our platform. You look at it, you validate it, and so it's easy.
Okay. Well, there's an application fee of 1,000 euros, right?
Yeah.
So in order for your application to be evaluated, there's a 1,000 euros. But from my point of view, this is always a plus, because companies should be somehow sure that they are ready and that they are scoring higher, so above 80 to be a gold company. But in the case where they don't score that high, they will always get a feedback report and one call with the evaluators where they will share feedback, right?
Yeah, absolutely. We've changed our system. Before it was a 1-page report. Now it's a 3-page report. So they get the written comments of each 18 items that they've been graded on. And now we've made the feedback call mandatory. So after they get their 1-hour call with the 2 investors, they get the 3-page report that details all the strengths and weaknesses that the evaluators feel from an investor point of view. And then they get a quick call with the evaluators, and the evaluators explain the results. I have to say, of course, we've had one or two occasions where startups were very unhappy with the results. That does happen. But we've had companies also who were not accepted and who said, this is great. This really gives me a good idea of what I need to work on. And it's sort of like if you're having a private one-to-one coaching session with two experts.
Yeah.
So
it's totally worth it.
It's totally worth it. Selected. Yeah, and the 1,000 euros is not only to pay for your evaluation and your reassessment, but in the case of where you are accepted, you get to benefit from our services for a full year for free. Yeah. So, if you go to any sort of broker, whatever, they might get a down payment of sometimes 40,000 euros just to look at your deck and rewrite it and etc. plus success fees. Today we don't have success fees, but hopefully we will at one point.
And it's always open, right? It's open on a rolling basis.
Yeah, absolutely, because everybody is fundraising at a different time.
Yeah,
everybody's in a rush, so we need to make it an ongoing process. Right. Yeah.
Let me see if we have. We have questions. I need to pick one or two because we've been chatting for a while now, so we will meet up very soon. So from José Antonio, Caroline, any advice how to become successful when IT comes to application process? I'm not sure if when IT or when it comes to the application. Maybe it's when it comes to the application process. Yeah.
So when you come to the application process, it means that you have a good idea of your business model, your exit strategy. You have a proof of concept. So I see in terms of TRL, you need at least a TRL 4 minimum. You have to have a good idea of your team. I would suggest that you're a full-time CEO as well, because I've seen that the ones who are not full-time, they have difficulty convincing investors, which is true, right? If you're asking for 5 million euros, the minimum is that
you're not fully committed.
Yeah, exactly. But you're not fully committed, that's an issue. So in essence, what we say is you need to have a good idea of where you're going and how you're going to go there. Even if you haven't reached those milestones, that's fine. But you need to say, okay, in 3 years' time, this is where I'll be going. This is how I'm going to do it. And this is how much money I need to do it. And if you've got more or less a good idea, then you can start applying.
Yeah. So we also have another question from LinkedIn user about the TRL, which you already replied. And if the product is being tested at the hospital, but we have not yet started raising anything yet. So this is what you're saying, like having, depending on what it is, but having some data, having a pilot, some proof that first it works and the market wants it, and whoever it's going to use, right?
Yeah, absolutely. It depends if we're talking about a biotech or a med tech, or if you're a med tech company, obviously, if you have to have some sort of proof of concept. And then you should be in your preclinical. You can be in your preclinical phase. That's fine, but you should have at least some sort of animal data to show, that what you're saying, you have something to back it up.
Yeah, exactly. When about timeline. So imagine a startup applies, submits the application. Their proposal is evaluated in
3 weeks.
3 weeks. You'll get the result. If you are accepted, you go into the platform and you stay there for 1 year. To manage expectations, because people sometimes think, oh, no, in one month, we're going to get investor. How long can it take?
Gosh, I think the shortest we've had is 5 months. And according to the amount you're raising, you will be looked at by different profiles, and according to the profiles, it will take longer. let me explain. If you're raising 500, 800, 900,000, you'll be probably looked at by angels or family offices. They're not going to, they're going to do a due diligence. It's going to take a minimum of 3 months anyway, but they won't be as nitty gritty, especially in the discussions and term sheets, as a VC would. So obviously, just to give you an idea, we had a closing of 900,000 euros. It took 5 months. Our biggest closing was 10.7 million. It took a year. So the more partners are involved in the syndication, the more you're dealing with VCs that will negotiate every period and comma in the term sheet. That's going to take a while. So be reasonable. So tell yourself it's going to take 6 months minimum. Yeah, if you're raising a seed, and if you're raising a Series A, tell yourself 9 months. And that's being pretty optimistic.
Yeah.
So when I have companies that say I want to raise by the end of the summer, is like, that's impossible. Nobody is going to give you 2 million euro, especially in Europe. In the US, it's different. But in Europe, nobody writes you a check of 3 million without looking at everything. And a due diligence takes time. So one advice I would give, Ines, if we still have time, is that if people are really in a rush, get your data room ready. Because once you do get investors interested and they start asking for material, have it ready. Because if it takes you 2 weeks every time to send them the info, then it's just going to drag out. So have your data room ready, when you join the Investor Network, we give you a special document to help you prepare your data room. It's a full investigation. It's a Sherlock Holmes investigation, due diligence. So they'll look into your contracts, into your debts, your bank statements, everything. So your science, your IP. So you need to get it ready, and that will quicken things up. And then when you get to term sheets, get yourself a lawyer if you can. That really makes things a lot easier.
Easier, yeah, definitely.
Mm.
So Caroline, if I had a company, I would be convinced. So I'm assuming our audience is also convinced.
Yeah, but let me be realistic. Let me just give you one figure. I mean, it's a challenging job raising money. It's even more challenging if a startup is doing it on its own. But even with us, it's very challenging because it's a question of, it's like girl and boy finding each other. You don't fall in love with everybody. Well, it's the same with investors. So we need to find investors that will invest in your country at your stage development, in your type of companies, and then you need to prove. So the other day I made an analogy. We're sort of like bridal planners. We prepare the bride. We bring the bride to the church. And then if the groom says no, we find the groom. But if the groom says no, then, we can't force him. So we do our best, but obviously not 100% of our companies raise. We're above the market level. We were talking about less than 1%. So far, we have 4% of all the applicants that get access to funding through us. And of course, we continuously try to make it better. But it's not everybody's going to get money. Yeah. That's the hard truth.
You have to try it, right? And with help and support of the Investor Network, things are easier, and the rates might be, and the chances might be higher. So.
Oh, definitely. We definitely boost the highlighting.
Exactly. Yeah.
And we definitely boost the highlighting, and especially we boost your European visibility. Because if from your Portugal, Italy, you might not know the good investors in Denmark, in Finland, in the Netherlands.
Exactly.
We do. So if we think they can be interesting for you, then we'll
reach them and ping them every
time.
Yeah.
We'll nag and tell them to look at you. Yeah.
Yeah. Caroline, thank you so much.
Well, thank you for listening.
It was great. Thank you also to our audience. We have here some questions asking about the video. Yes, it will be available on EIT Health InnoStar's Facebook and LinkedIn pages. You also have all the websites with from EIT Health, InnoStarter, Investor Network. You can scroll all the information there. And remember, this is the Investor Network. It's open on a rolling basis. Companies can apply anytime. If you have any questions, just reach us. We'll be able to support you, schedule calls, but apply. Apply when you know you're ready, and I'm sure you'll be as successful as possible. So thank you again, Caroline, for being here today.
Great. Thank you for inviting me. Lots of fun. Thank you.
And dear audience, we see you in 1 month.
Take care. Bye-bye, everyone.
Bye-bye.